Welcome to another Spine West webinar. Today we're going to be talking about muscles, how to keep them, build them, keep them from dying. Specifically talk about sarcopenia that affects older people. So what are muscles? Muscles are the body parts that make us move, give us bulk. Some of us have large muscles, some of us smaller muscles, some of us are in between, and some of us just don't have a lot. But what you need to realize is that people that are well-built, bodybuilders, have the same number of muscle fibers by and by as the average person. It is not the number of muscle cells, but it's the size of the muscle cells that gives people the bulk of their size. However, as we season or as we age, we start to actually lose muscle fibers, and that's called sarcopenia. Today's emphasis is how do you keep that from happening, and what can you do to kind of build your strength back? So if you look at this diagram of a normal muscle cell and a sarcopenic muscle, you can see that the muscle that has atrophied a little bit shows some fatty tissue around it versus the very full and plump muscle of a younger person. This is a sign of aging. Now, it doesn't have to happen, but it does come with time. There are cells in the muscle which regenerate called satellite cells. Not quite sure how to activate those as of yet, but the concept is use it or lose it. So muscle cells have different types of fibers. You have type 1 fibers, which are the aerobic kind of long distance, low fatigue type fibers that you get with runners. And then you've got the power muscles cells, the muscles that give you that oomph or that full push that you need for doing certain activities. These are the type 2 muscle fibers that are oftentimes lost with sarcopenia. So exactly what is the difference between sarcopenia and muscle atrophy? Well, sarcopenia is when you actually lose the number of muscle fibers, and regular atrophy of the muscles is when you just lose the size or the plumpness of the muscles. What are the causes? Well, one of the main causes for losing muscle fibers, not just shrinking, but actually losing the number, is birthdays. As we age, we start to lose the number of cells that we have in our muscles. Other causes include prolonged bed rest, such as with illness or just not being active. Medications sometimes can affect the muscles, specifically corticosteroids, prednisone. That class of medication will shrink away the muscles, especially in the limbs, and move some of the tissue into your body. Another big cause of losing muscle fibers and also muscle bulk is protein. Protein is a core component of muscles, and if you don't get adequate protein, you will lose your muscle fibers. How do you diagnose sarcopenia? You really can't. It's a silent disease. It will slowly creep up on you if you let it. But there's ways to prevent it by working out. Use it or lose it, as we say. Motion is lotion. With that, you don't have to go to a fancy gym full of equipment in order to get your muscles strong. In fact, your home, I'm quite sure of it, has a home gym. Here are some examples of some of the equipment you probably have at home. The toilet. You probably get down and up on the toilet once. Have you ever thought about rising and sitting 5 times or doing it on one leg to see if you can build your strength just standing up, or doing that from a regular chair or a deep sofa? Using a countertop like a kitchen counter or a bathroom counter, you can use that to do exercises like standing push-ups, leaning into it, and exercising your muscles. So you don't have to just use it as a platform for placing things. You can actually use it as a way to exercise your muscles. Stairs. Stairs are great tools for exercising your muscles. going up the stairs, going down the stairs. Instead of doing it once, do it twice, 3 times, 5 times. And the trick is to do it in a way that actually builds strength. So you really focus on keeping and maintaining the power muscle cells in your body. Going up the stairs quickly by 1 step and going down the stairs slowly by 1 step is good exercise. You can also go up the stairs 2 steps at a time to really get a load, but you have to limit yourself by the knee pain, etc. Holding onto the rail, of course, depending on your frailty, but you can use the steps as a piece of gym equipment in your home to really get the power out of the muscles. Now, there's different types of exercises that we use to build strength. There's something called isometric exercise, which is like this leg, and it's keeping one limb or one muscle contracted without moving the joint. So the muscle is not changing its length. That's an isometric exercise. A concentric exercise is when you actually bend the muscle or shorten the muscle, and that is a way to actively engage the joint and the muscle at the same time. It's not isometric where you're activating the muscle without moving the joint. You're actually moving the joint. And people with arthritic joints can use the isometric exercise, just tightening up the muscle and holding it for 60 seconds. Or if your joint doesn't hurt, you can move the joint and bend it. Now, the maximum juice from the squeeze you'll get from exercise is called the negative, and that's called eccentric exercise. When you're bringing a load down towards the center of the earth, so your muscle is actually lengthening as it's firing, will build more muscle strength than if you're doing the concentric or the shortening of the muscle. So going up the stairs is going to be a concentric activity of your thigh muscle, of your quadriceps, because you're actually shortening the muscle. If you go down the stairs, you're using your quadriceps to control your descent, and it lengthens the muscle as you do that, which builds a little bit more juice from the squeeze. If you can do a concentric exercise combined with an eccentric or a negative load exercise, sometimes it's good to do a rapid up and then a slow descent down. So you can do a 1 to 3 or 4 count, and that release or that extension of the muscle slowly will build quite a bit of muscle and give you juice from the squeeze. Another thing you can do is just do push-ups. Now, if you can't do a regular push-up on flat ground, you can use a countertop, a dresser, something that's not going to move on you, but you can do the same concept. You can go down slowly and then come up, and down slowly and come up. And one way to keep it somewhat fun is instead of counting to 10, you can count. You can not count. You can just spell your name in the longest form possible, depending on how many letters are in your name. But that can distract you from actually counting to 10, because sometimes the numbers will make you fatigued. But if you spell your name while you're doing your exercise, it actually takes away the concept of it hurting. So give that a try. Be creative in your exercise. See what you can find to do something, not just once, but a few times, that actually gives you some juice from the squeeze. So you don't have to necessarily have a 45-minute-a-day program to maintain your muscles. You can literally find it at home if you're creative, and you have to be able to push yourself out of the chair when you're older. You have to be able to climb up the stairs. You have to be able to get up off the ground. You need to be able to push yourself out of a chair. So all those functional types of motions is what you should be working on. That way, keeps you functional, lets you enjoy life. Quality of life is all about maintaining your strength, balance, and overall coordination. That's what we're talking about at Spine West. Hope this was helpful for you. A couple of life hacks for maximizing your time to maximize your health. Have a good one. We'll see you next time.